This is an A-level biology presentation looking at lung diseases. To get started, make a list of all the factors that could affect your chances of developing a lung disease. Pause the presentation, spend 5 minutes, and when you're ready you can restart the presentation. There are a number of factors that can affect your chances of developing lung disease, but the 5 pictures in front of you give 5 of the main factors that you should be aware of. So if you haven't already done so, take another minute, try and identify what each of the pictures represents, and when you're ready, restart the presentation and we'll go through the answers. So pause now. Well, the 5 different images represent your genetic makeup, we have your occupation, we have infections, air pollution, and of course smoking. And all of these will affect your chances of developing lung disease. In this lesson, we're going to look at some of the causes and symptoms of common lung diseases, and we're going to look at some data and look at correlations and causation relationships. Remember, we're talking about a relative risk. It's not guaranteed that if you don't get in contact with any of those factors that you're not going to develop lung disease, which just probability. So for example, if we talk about smokers, for every 30 per 1,000 people with lung disease, 30 of them are smokers, whereas we only have 10 who are non-smokers. What that means is that if you are a non-smoker, you're less likely to develop lung disease. What you have to do now is find the ratio between the incidence of disease in those who are exposed to the factor and the incidence not. So take those two numbers and turn them into ratios. Pause the presentation. When you've got your answer, you can restart. Well, what you do is you take the relative risk, it says in the question, between those exposed to the factor, so smokers, and then the second one is the incidence of those not exposed, which is the non-smokers. Hence, we have to put it the ratio values of 30 to 10. And if we divide 30 by 10, we have a relative risk of 3. Remember, we can turn that into an actual statement if we're asked to use the data to explain something. And what we can say is that the smokers are 3 times more likely to develop a disease. They are not definitely going to develop a disease. There's plenty of people who smoke who won't, and vice versa. There's plenty of people who don't smoke who will develop the disease as well. But what we can say from this information is that using the data, smokers are 3 times more likely to develop the disease. There is a huge amount of research with smoking and cancer, and certainly from my own personal experience, the number of young people that smoke has been going down consistently over years. When they went and did a particular investigation, in this particular case, they selected groups with lung cancer and groups with other conditions. They were asked about the smoking habits, and what they found was a higher proportion of lung cancer patients were regular smokers. But it was not considered absolute proof. In the 1950s, you have to remember, the smoking companies were worth an awful lot of money and paid an awful lot of people to be on their side and an awful lot of sponsorship. So it was not a foregone conclusion with one piece of research. And why might the data be considered unreliable? Well, the data might be considered unreliable because people lie. We're doing a check to see how many of you smoke. People are not always going to tell the truth, either deliberately or unintentionally. They may over or underestimate the number of cigarettes that they smoked. In the same study, they chose British doctors and they ran it for 50 years. The study actually ended in 2001. So what are the advantages of using doctors rather than just members of the public? Pause the presentation, spend a minute, come up with your answer. Well, the advantage was that cigarette companies were using doctors to claim that it wasn't cigarettes that gave you the problem. There's actually a number of adverts where you can see doctors are being used to promote the healthiness of cigarettes and how some cigarettes are really better than others and are really good for you. We also have to remember that when you get evidence from people in white coats, people are more likely to believe it. It's just human nature. We also had a case where doctors carry out medical research, and they know the importance of medical research, and they are more likely to tell the truth. Not definitely, they're still human, but they are more likely to tell the truth in a medical study because of their professional integrity. And of course, the doctors were easy accessible in the hospital, so they were much more readily available should they want to be tested or do any kind of work with them, so it did make it easier to actually do the tests rather than bringing people in from the general public. What we've got here is a smoking advert from 1949, and well, I'll just let you watch it and you can form your own ideas.
You know, if you were to follow a busy doctor as he makes his daily round of calls, you'd find yourself having a mighty busy time keeping up with him. Time out for many men of medicine usually means just long enough to enjoy a cigarette. And because they know what a pleasure it is to smoke a mild, good-tasting cigarette, they're particular about the brand they choose. In a repeated national survey, doctors in all branches of medicine, doctors in all parts of the country were asked, "What cigarette do you smoke, doctor?" Once again, the brand named most was Camel. Yes, according to this repeated nationwide survey, more doctors smoke Camels than any other cigarette. Why not change to Camels for the next 30 days and see what a difference it makes in your smoking enjoyment? See how Camels agree with your throat. See how mild and good tasting a cigarette can be.
And that's an advert in favor of smoking. That's the kind of the momentum that they had in the 1950s and 1940s. You can see some of the posters as well. As your dentist, I would recommend Viceroys, and Luckies are less irritating. Yes, they may be less irritating, but that doesn't mean you should be doing them. So you can see quite clearly, initially there was quite a huge bias against this research linking smoking to lung diseases.
You know, if you were to follow
We have three main types of lung diseases. Look at each of the pictures and try and work out what those three main types of lung diseases might be. Pause the presentation, spend a minute, come up with your answer. When you're ready, you can restart. Well, in the first one, we are looking at the airway diseases, which is the trachea, the bronchi, and the bronchioles. What we can also have is we can have the lung tissue. And then the last thing we can look at, of course, is we can have circulation diseases involving blood vessels around the alveoli. And when we talk about airway diseases, what they're basically looking at is the tubes that carry the gases in and out of the lungs. And most of the diseases will narrow or completely block those particular airways. Things like asthma and bronchitis. And what you essentially end up with is narrowing and narrowing of tubes, so you have less volume of gas being able to move through those tubes at any point. In terms of lung tissues, what you actually affect there is some sort of scarring or inflammation of the tissue, which restricts the ability of the lungs to expand. So sarcoidosis is a classic example of that. Pulmonary fibrosis is another one. And what you're essentially doing is it's like having a weight on your chest or being tight into a wetsuit, and you've got that compression around your body. And it's very difficult for these people to take big, deep breaths. Their breathing is normally much more shallow. And the third type, of course, is the one looking at the blood vessels. Again, it can be clotting, scarring, inflammation. There's all sorts of different conditions. Pulmonary hypertension is one. But what we're affecting is the ability of the lungs to take up oxygen and release carbon dioxide. So the gas exchange is what we're looking at, and the rate of gas exchange. One of the things you may be asked to do in the exam is to calculate what's called the pulmonary ventilation rate. And what you basically have to do is you have to get how deep someone is breathing, the volume of gas they can intake in a breath, and you multiply that by the number of breaths per minute or the breathing rate. And when you put those together, you combine it to get what's called the pulmonary ventilation rate, which is basically how much gas is moving into and out of the lungs per minute. If you have to rearrange the equation, which is not impossible, but unlikely, remember you can use what's called a smurf, which is the little triangles in the bottom right hand side. And what you have is you've got a multiplication sign. So if you've got two variables multiplied, they go on the bottom level. And when we've got division, it's the top line divided by the bottom line. So if we rearrange those equations, we get them as follows. So when you rearrange the equation, you get tidal volume and breathing rate at the bottom, PVR at the top, and tidal volume is PVR divided by breathing rate, and breathing rate is PVR divided by tidal volume, or as I say, PVR is tidal volume multiplied by the breathing rate. Remember, we have these concepts called causation and correlation. You need to be very clear on the definitions of them. In causation, we've got a direct relationship knowing that A caused B, and A will always cause B. If, however, and what's quite often more common in science, we deal with what's called correlations. And what we can say as correlation is there's some connection between two variables, but we are not sure if A is causing B, or if B is actually causing A, or if something completely different, C, is actually causing A and B to happen. So you're going to be shown some graphs, and what you have to do is extract as much information as the graph before the timer runs out. So when it comes to interpretation of graphs, unless you're asked a specific point, the best way of doing it is to start with general patterns and then start going into more detail. And the general pattern is that the earlier in life that you stop smoking, the more you extend your life by. We then start looking at it in a little more detail, and you can see that at 35, life is extended more for males. At 45, it's approximately the same for both sexes, whereas we get to 55 and 65, you can see that women who stop smoking at that particular time are going to extend their life more than men. Once again, start with the overall patterns and trends, and we can see that in this particular graph we actually have two y-axes, the one on the right which is the solid color lines and the ones on the left which are the dashed lines. On the right we're looking at lung cancer rates, on the left we're looking at smoking rates. And you got to be careful with these types of graphs because they'll have different scales on each y-axis, and it's very easy to miss information and cost you an awful lot of marks for a very silly mistake. The overall pattern is that lung cancer rates in men are decreasing, they are increasing in women, and the overall reduction in the smoking rates of men and women is decreasing, so there is a reduction overall. You can then start looking along the bottom and start looking to see what impact each of the different things that were brought in and introduced. For example, if you look at when cancer smoking first like demonstrated in the 1950s, it didn't really have a huge impact in terms of the smoking rates. It's only when we started pulling TV adverts that we start to have that general decline. Banning adverts may have contributed to the reduction of smoking rates. We don't know for definite. There could be other reasons for it, but there is definitely appears to be some sort of correlation, because when tobacco TV adverts are banned, the rates of smoking went down for men and women. So again, we're going to look for general patterns and trends. The general pattern and trend is that there's a decrease in the percentage of the population who smoked since 1974. What we can also say is that between 1994 and 1998, there's actually an increase in the percentage of men who smoked, and you can see that with a little blue line in the middle going upwards. Other than that, we've got an overall decreasing pattern. You can make reference to the rate of change, but there's no real pattern in the rate of change. So this is a particularly unusual looking graph. And what you've got is you've got deaths by smoking, and the thickness of the bar represents how much of the deaths are smoking related to those particular age groups. Notice the data is taken across the world. And what we can say is that of the people that die from smoking related issues, less than 10% are between 15 and 49. And what we can say there is, if we had to explain why, we can say things like they may not have been smoking long enough to have the effects of smoking impact on their health. You can also talk about the fact that the number of people under the age of 49 may be lower. Hence, if there's fewer people smoking, there's fewer people going to die from it. What we can also say, if you look at the top bar, is that the number of people with smoking related issues in the age of 70 and above is increasing. And again, that can simply be that people who have been smoking in the 1950s and 60s would now be coming up to 70 years of age, and as a consequence there would be an increase in the population of a number of 70-year-olds, and therefore if most of them smoke, it would impact on the deaths from smoking. Remember folks, you've got to be careful. When you're asked, you've got to look at the question descriptor. Are you being asked to describe what is happening, what you see and what the pattern is, or are you being asked to explain it, which means you've got to say why that is happening. And just to finish off the presentation, complete a plenary triangle. So 3 things you knew that were mentioned that you'd already covered in the previous lesson or knew from general knowledge, 2 things you've learned this lesson, and 1 thing you're still not sure about that you should go back and look up in the video.